Hello and welcome once again to Moorgate Andrology. Now today we're going to talk about Peyronie's disease and in particular a surgical procedure that can straighten the penis whilst protecting its length. And this procedure is called plaque incision and grafting. Plaque incision and grafting. But before we talk about that, just a word or two about Peyronie's disease. You know, at Moorgate Andrology, we see a lot of men who suffer from Peyronie's disease. And Peyronie's disease is shall we say, an unnatural curvature of the penis when the penis is erect. When the penis is flaccid, it may appear perfectly normal. But on erection, it takes a tangent all of its own and an unnatural curvature. This curvature can be up, so the penis is almost pointing back towards the body. It can point to the left, it can point to the right in various degrees. So in such cases, it can make sexual intercourse quite difficult because there's an unnatural angle of the penis on erection. And it can be uncomfortable or painful for you and or your partner. And in such cases, when the curvature is so significant, then the only real course of action to make the penis straight again is a surgical procedure. In the NHS, the most popular procedure performed is the Nesbitt procedure. The Nesbitt procedure. And this procedure will straighten your penis. But the Nesbitt has one drawback, and that is it leaves the penis shorter than it was before. And the worse the curvature, the more the shortening. So if you imagine the curvature on the penis, here you have a short side and here you have a long side to the penis. And whatever is done to make the penis straight, the two sides have to be the same length. And in the Nesbitt, a tuck is made on the long side of the penis to make the penis straight. But as it does so, it makes it the same size as the short side, and this is why it leads to penile shortening. Now, at Moorgate Andrology, our procedures straighten the penis, but the focus is on preserving the length. And the plaque incision and grafting surgery is just one of the procedures that can do that. So this procedure is performed by a urologist and it's performed under general anesthetic. So you're asleep when you have it done. And it takes about 1.5 to 2 hours to do. And you're able to go home on the same day as the procedure. The plaque incision and grafting is different to the Nesbitt insofar as the surgery is performed on the short side of the penis. And incisions are made to open the penis to straighten it. But when this is done, a gap or a hole is made in this straightening process. And this gap must be filled by something. And it's filled by a graft, a man-made graft that acts as a matrix or a scaffold for the formation of new collagen. And that's exactly what happens. And with the plaque incision and grafting process, with this method, the penis is made straight, but also it protects the length. You may have some slight shortening, maybe half 1 centimeter, maybe, but significantly less shortening than the Nesbitt procedure. 6 weeks after the surgery, when everything has settled down, we give you a traction device that you wear on the penis for 1 to 2 hours each day, each evening. And this puts the penis in a slight traction. And over the course of the following 9 to 12 months, this can help to rehabilitate the penis and gain back a little of the loss that you may have experienced with the plaque incision and grafting, albeit minimal loss. This traction device can help regain that. Now, after plaque incision and grafting surgery, you'll need to take a little time. If you have quite a strenuous job that is involving any heavy lifting, you may need to take up to a week off. You have a desk job, maybe 2-3 days may be enough. But you have to listen to your body. You should plan to take a little bit of time off. After the surgery, we'll have some swelling, some bruising of the penis. There'll be a compression dressing on at first. And everything takes around 6 weeks to settle down. So therefore, there is no sexual activity for 6 weeks after the surgery until everything is healed. When the surgery is finished, you should have a straight penis and also a penis which is looking more like it used to do. Of course, it's never exactly the same as it was before, but it will look more like it used to do than if you'd had, for example, the Nesbitt procedure. Now, plaque incision and grafting surgery is just one procedure that can be performed to straighten the penis and protect its length. Other procedures include the so-called stage procedure, where this perhaps is more suitable in relatively mild penile curvature of less than 40 degrees perhaps, and also in cases of congenital penile curvature, which is something different. This is penile curvature, but it's something that you're actually born with. So if you have Peyronie's disease, it's really important that you get the best advice, and that will be from a urologist. Of course, if you need to be diagnosed, you can see your GP, get some information about the procedure. Peyronie's disease does go through 2 phases. It goes through an acute phase, where sometimes there is at first pain on erection, you're noticing this curvature developing, and eventually the disease moves into a so-called stable phase, where there is no change in the penile curvature. And it's in this stable phase that we will do the plaque incision and grafting surgery. Timing is really important for this operation, and it's important that it's not done too early, because if it's done too early when the disease is still in the acute phase, there's a higher chance of recurrence, and of course we want to avoid that at all costs. So the disease is done in the stable phase. Well, that's all from me today. I hope that's given you some insight into plaque incision and grafting surgery, procedure performed to straighten penile curvature whilst protecting its length. If you liked the video, please do click the like button. And if you'd like to see more videos from Moorgate Andrology, we invite you to subscribe. But that's all from me today. I look forward to seeing you back here at Moorgate Andrology very soon. But until then, bye for now.